would say the acuity of the patients that we treat here, so how sick they are when they come in, is the highest of any place I've ever been. It really is. We're really treating those that truly need to be here. At the same time, I think one of the exciting things that I think about Stanford is you have all the science, the technology, the school that really is at the very best in the country. And so you marry all those together. And this new facility will allow us to continue to do that amazing research, be able to produce the science that then produces the Nobel laureates and all the pieces. And so it really is, Stanford is a step above. What we're trying to do is just present this to the community. It really is, I think whenever you go through a project like this, there's obviously a lot of construction and trucks and disruption, so to speak, in the community. What I hope that what they will see is that they now have a resource for them that's available to everyone that can come in and provide them care when they need it at a time that may be a critical aspect of their life. And so whether it's something that the local community needs that maybe is something fairly simple to something that's a level 1 trauma or a CAR-T transplant or something that may be very probably acute in terms of what they need. I hope they see this as a great resource and an environment to be able to do that in. We've actually built furniture into the room for the patient's family to be able to have their own space, to be able to have storage, to be able to plug in their devices, to be able to have a private area as well. And so I think all of that, pulling the patient into that, allows you to really create a better experience for or I should say pulling the family into the patient experience provides a better piece there. So we have literally an iPad. Every patient in a bed will have an iPad. That iPad will control the temperature of the room, will control the lighting, will allow them to communicate with family, their physician, be able to get real-time learning. At the same time, they can order food from that. They'll also have a 55-inch screen in the TV so that they can interact, see different things that are trying to be part of their care. And so taking that technology that we use on a day-to-day basis and enabling patients to better understand, better communicate. I think one of the sense of a patient when they come into the hospital is they have such a loss of control on what they can do and their ability to connect. And so being able to use that technology to better let them connect. We do have in September, very excited about being able to showcase across 2 days, literally all day, community days. So inviting the public in to not just tour the building and see it, but to have an experience in the building. And so they can see a little bit about what we do, whether they're experiencing what we're doing in the OR, the ER, or different places. One of the exciting things of new technology is we actually have automated robots, or tugs, that actually move the supplies around, can go and pick up a laundry cart, take it. So a lot of times things that we are challenged perhaps to find staff to do, we can use automation to do that. We have pharmacy robots that actually make sure that the automation and the pick is 100%, so you're getting the right medication to the right patient. So just some exciting things to see. But yes, the community days will allow folks to be able to come and see that. So we really want to tout getting as many people as we can to see it. We have the ribbon cutting is on October 23rd, and we're looking to have the first patient in the door either later that week in October or the first part of November, right around in there. So just in terms of timing of approvals with all the regulatory bodies and everything, just getting everything finalized and ready for that first patient. But right in that, let's say November 1st timeframe.